The World Health Organization has criticized the speed of the COVID-19 vaccine rollout in Europe, saying that it is, quote, unacceptably slow. The new number of cases across the region has increased for the sixth consecutive week, and just 10% of the European population has been given their first vaccination dose. The warning from the WHO comes as the EU failed to meet its vaccination targets and distribution schedule by the end of March. Joining us from Copenhagen, we have Dr. Siddhartha Sankardata. He is the WHO Europe Regional Advisor for the agency's Vaccine Preventable Diseases and Immunization Program. Thank you so much for joining us. What do you think has gone wrong with Europe's vaccination program?
So thank you so much and good morning from Copenhagen. So let me start by telling that with 47 of our 54 member states and territories who have started to roll out the vaccination COVID-19 vaccine program, and also 148 million doses been administered already in the WHO European region, is a testament that people are willing to receive the vaccines and governments are making their all efforts to roll out the vaccine and to provide the benefits of this vaccine to its population. Having said that, I think it's an opportune moment for all of us to start looking into how this can be done much more faster and much more efficiently moving forward.
Right. But, you know, the WHO, which you work for, says that this has been unacceptably slow on the continent. I mean, that's a pretty strong statement there. What could happen if the vaccination continues at the current pace? Are you worried?
I think if we look into the average of the countries rolling out the vaccination, it starts from less than 1% of the population covered to more than 50% population covered. Obviously, this you can see that the rollout it's not catching up with the same pace in every country. With the slow rollout happening, we do understand that not all countries started at one point of time, but there is an opportune moment now to see that this can go further. What can happen, as you have asked, is as the rollout becomes slow, as the rollout at the pace in every country are not catching up, we are just prolonging the pandemic. The vaccine is an efficient tool which is available for us so that the population can benefit from. That's the slowness of the pandemic, or pandemic being prolonged is one thing. The other one is, as if the rollout is happening slowly, we are allowing the other variants of concern, the virus trying to find its own way to escape this entire tools that we have. So it just prolonged the pandemic further.
So what's your recommendation then? How do you see an opportunity for Europe to swiftly improve the rollout of its vaccination program and make it more efficient?
Yeah, exactly. Thank you. I think the most important thing that all of the countries need to do is to start looking into the vaccination coverage of its targeted population groups. They have started with the high priority group, the healthcare workers, people more than 65 years of age. All countries need to start looking into the drivers and barriers within this population group, what is holding them or holding them back to get that vaccination coverage high in each of these population groups. Once that is done, once we look into the data, those are available, they should start looking into what are the causes that these vaccination uptake in this population group is not high. Once that knowledge is being gathered, they need to then start tailoring interventions which will be allowing them to improve the vaccination uptake in those countries.
Let's talk a little bit more about those interventions specifically, because, one thing is the production and the logistics of simply getting the vaccines, getting them to the facilities and then into people's arms. Another thing is this vaccine skepticism. European heads of governments seem to be in constant disagreement over which vaccine is safe to use. We saw that, most recently, of course, with the blood clot issue that has been reported with regard to AstraZeneca and the abundance of caution that some leaders are using. To what extent is this part of the problem?
Yeah, thank you. So I think one thing, let me then break this into two parts. One is when people listen to these type of concerns, people may have a different perception. It's extremely important that governments, scientists, research and developers are open to the population being more transparent of what we know, what we don't know, and what is coming. I think this will instill trust in the population about this new novel COVID-19 vaccine. The people's skepticism should also be seen within the lens that this is their health-seeking behavior. They are trying to make a conscious and informed choice. What is important is that the people get access to trustworthy and reliable information that can come from the ministries of health, that can come from organizations like WHO. These information are out there, and population need to get access to it. We have also seen people's perception or skepticism, if you want to say about it, in other vaccines. This is not the only vaccines that we have seen. What is extremely important at this point of time is that we learn, we listen to what people want, and if vaccine safety is one of the concerns,
right,
we share with them what we know at this point of time.
Thank you so much, Dr. Siddhartha Sankadatta, WHO Europe Regional Advisor for the agency's Vaccine, Preventable Diseases and Immunization Program. We appreciate you joining us here on DW News.
Thank you so much. Pleasure talking to you.
And fear and frustration is growing in Germany with coronavirus cases on the rise. Authorities reported nearly 22,000 new infections on Friday and 232 deaths. Germans have lived in some form of lockdown since last year. And after months of restrictions, many people have lost trust in the government's response. Our correspondent, Leonie von Hammerstein, asked people in Berlin how they would describe the government's pandemic management.
Confusing. Das ist ziemlich
pretty
chaotisch.
chaotic.
Good, I'd say, given the circumstances.
It's difficult for everyone.
Terrible. Yeah, terrible.
These Berliners are not alone. According to the monthly national survey ARD Deutschland Trend from the polling institute Infratest DIMAP, 79% of Germans are critical of how the country is managing the crisis. It's the highest number since the start of the pandemic. Only 24% are okay with the measures as they are. About the same say they go too far, while half of Germans think current measures are not restrictive enough. The country is in the middle of its third wave of the pandemic. The number of new infections is rising exponentially, with a highly contagious UK virus variant now dominant. But the vaccination rollout has been slow, and the Chancellor and state premiers can't seem to agree on a course of action.
So if so many people are so frustrated with the government, then maybe they have better ideas of how to handle the pandemic. If you were Chancellor Angela Merkel for one day, what would you do differently?
I would look to countries like Taiwan or Singapore or even Thailand, and just try to see what did they do different, because nobody likes a hard lockdown. It takes a lot of quality of life away from a lot of people. It makes people feel lonely, and Taiwan managed to deal with the pandemic very well from the start.
Opening it up for open discussion, letting the ideas combat and go back and forth, and finding out which is the best idea, that's what I would do.
I would get as much vaccination as possible for everyone. Just to make everyone feel safer and feel like we can get out of this. Because right now it doesn't look like it's going to be over soon, and that's really frustrating.
A lot of ideas for the Chancellor. Her party is under pressure to show a way forward. If elections were this Sunday, the Conservatives would only get 27% of the votes, 6 percentage points down from 1 month ago. Merkel's party still has some time to prove it can get it right, until September, when Germany's general elections are held.
And thousands of Germans have traveled to the Spanish island of Mallorca this year for spring break. For many, it's an annual tradition, but in the midst of the pandemic, Chancellor Merkel has warned against it. Vacationing in times of the coronavirus is controversial, as it's considered a so-called pandemic driver. Reporter Jan-Philipp Scholz finds out from tourists and locals whether all the fun is worth the risk.
Slowly but surely, Playa de Palma is filling up with tourists again. This is where most Germans who book a trip to Mallorca over Easter choose to stay. Restaurant owners are pleased. Every day, more beach bars open up their outdoor terraces. But it's not just the beach that's popular. Activity has picked up at doctors' offices as well. Starting this week, tourists must get tested for coronavirus before returning to Germany. You have various options. You can make an appointment at the airport, then you don't have to wait at all, but you pay more. As far as I know, there are also 2 other places near here where you can take a test. So personally, I don't think it's all that bad, to be honest. We won't be doing this again. It was nice to get away for a few days, but the hoops we have to jump through to return and the fear that comes with being tested is too much. What if it comes back positive? The whole thing is just exhausting. Despite virus fears, the island expects more than 40,000 German guests this Easter. But things look completely different in Magaluf, just a few kilometres away. Normally, this location is firmly in the hands of British vacationers. But unlike the Germans, they're not allowed to travel at the moment. Those who do face hefty fines. So the mood in the town is glum. 50 to 60% of the businesses here will have to close completely. It's simply become impossible to pay rent without any revenue. Right now, the infection rate on Mallorca remains low, but it has been slowly rising. Some fear that the island will soon close again completely. Pau Rodriguez comments on the back and forth between reopening tourist attractions and reimposing restrictions with his biting caricatures in Mallorca's local newspapers. For him, the pandemic has shown that mass tourism on the island is a thing of the past. It's like a medicine. The right dose is great, but too much is dangerous. It used to work well on the island, but then suddenly 5 times as many tourists came. Many in the tourism industry are exploited. In the 80s it was better. Less tourism leads to a better quality of life. In the meantime, several hotels on the island have already been converted into quarantine accommodations. And this is where some German vacationers who tested positive are staying. They are required to wait at least 2 weeks before they are allowed to return to Germany.
Jan-Philipp Scholz is standing by there on a beach in Mallorca. Jan-Philipp, tell us, why are so many Germans vacationing amid the pandemic?
Well, right here at the beach, as you can see, there is something like a holiday feeling, more or less at least, especially since the weather has been quite nice in the past days. But at the same time, it's not really a holiday as we used to know it. Nothing is left of the reputation of Mallorca as a notorious party place, for example. Bars have to close at 5 p.m. People can sit in cafes during the day, but then they can just go for a walk or they go back to their hotel rooms. So nothing is the same as it used to be on Mallorca.
And those restrictions that you're mentioning are just some of the safety measures that are in place. How strict are they? How do they work?
Well, Mallorca has really put very strict measures in place, and they are also enforced in a very disciplined way. I've seen it myself at the airport 2 days ago. It took me almost an hour to fill out all the health forms, the health declaration forms, pass all the health checks. And I also had to show a justification letter that I travel as a journalist. So Mallorca really wants to show that secure holidays during the pandemic are possible. And of course, for them, the upcoming summer season is much more important than this Easter break, though, so they don't want to put this at stake by any means.
Are people in general in the country, in Spain, worried about another wave of infections? And what are the case numbers like at the moment?
Yes, they are worried, that's for sure. And it's also sometimes a difficult situation between the locals and the tourists. As you know, there's also been a very heated debate in Germany lately if it's really responsible to travel in the times of a pandemic, and some holidaymakers told me they almost feel as if they are considered as criminals, but they are definitely not to blame for the rising infection numbers that we see here in Spain at the moment. Numbers are rising again. People are already talking of a fourth wave of infections, and a lot of health experts blame it mainly on the relaxation of measures in the past weeks. Here on Mallorca, numbers are still low, but they are also rising, but on a low level compared to the rest of the country.
DW's Jan-Philipp Scholz reporting from Mallorca. Thank you so much.
Thank you.